Our top story this hour, in a first of its kind, the Oxford University is going to conduct a study in which it will be alternating doses of COVID-19 vaccines created by different manufacturers to find out whether the combinations of vaccine jabs can boost the inoculation drive. And the medical trial by Oxford will try to find out whether different COVID-19 doses, those created by AstraZeneca, Pfizer-BioNTech companies, can be used interchangeably to allow greater flexibility when countries are facing a shortage of vaccines. The British government's deputy chief medical officer said that the trial will offer a greater insight into the use of vaccines against COVID-19, and the 13-month study will compare different combinations of prime and booster doses of the AstraZeneca and Pfizer vaccines.
It's an important trial. We're supporting it through the Vaccines Task Force with £7 million. It will report probably after the summer, and of course it will have no impact on the deployment.
Britain is also the first country to begin a vaccination drive against the coronavirus. Different variants of coronavirus has left several countries more worried now. Scientists and researchers are also looking whether the vaccines will be able to fight the different COVID strains that are more transmissible. In the United States, the new coronavirus cases appear to be on a downward trajectory, but the CDC director has warned that the new COVID-19 variants popping up across the US could threaten this positive momentum.
Although we have seen declines in cases and admissions and a recent slowing of deaths, cases remain extraordinarily high, still twice as high as the peak number of cases over the summer. And the continued proliferation of variants that likely have increased transmissibility, that spread more easily, threatens to reverse these recent trends. Based on contact tracing and recent variant cases, not wearing masks and participating in in-person social gatherings have contributed to the variant spread.
Now, the world has its eyes on the team of WHO experts investigating the origins of coronavirus. The team of investigators has now said that the work is needed to be done to trace genetic elements of the virus in bat caves. The WHO team investigating the root of COVID-19 have said that they are getting data no one has seen before. But the focus is now on bat caves. Bats may hold the key to the origins of the coronavirus, and looking into the bat caves of China is important to understand this.
That sort of work to find the likely bat source is important, because if you can find the sources of these lethal viruses, then you can reduce the contact with those animals and reduce the behaviours that put us at risk and prevent pandemics. A virus get from bats in some other part of China or Southeast Asia into Wuhan. And that's the real work that we're doing here. We're trying to trace back from the first cases back to an animal reservoir. And that's a much more convoluted path. And that may have happened over a period of, a number of months or even years. So it is a process.
Earlier this week, the WHO team visited the heavily guarded Wuhan Institute of Virology. This included an extremely important meeting today with Dr. Shi Zhengli, and Zhengli is a well-known virus hunter who has long focused on bat coronaviruses. Now, this has earned her the name of Batwoman in China. Bats are often a repository of viruses which are often benign for them but harmful for humans. There are many bat caves in China's Yunnan province. Researchers have called for repeated access to bat caves, but China has been actively denying entry. Earlier, the Associated Press reporters were tailed by Chinese security agents when they tried to visit the caves. They were stopped. Some researchers also had their samples confiscated. WION is now available in your country. Download the app now. Get all the news on the move.